Hey everyone, thanks for joining today. I'm Alan Morris, Senior Vice President of Strategy for VGM, joined by Tyler Coulander, our Market Strategy Manager. Tyler, good to have you.
Thanks, Alan. Really excited to be on today. Even more excited to talk through some of the data that we're going to unpack on this podcast episode related to Medicare's Shared Savings Program. We're pretty excited to not only walk through some of the data at a high level, but also discuss what it means for our industry. So it's great to be on today.
Yeah, Tyler, absolutely. We'll get into it here in a second, but I think as all of you know, and certainly as Tyler and I have communicated over the last few years, we're amidst a really heavily evolving healthcare landscape, and Tyler's going to share some insights into a couple pieces of that have some cascading impact and present opportunity for DMEs. So let's get started. So first of all, let's start with the headline that we saw just the other day from CMS suggesting that accountable care organizations specifically in the Medicare Shared Savings Program, which is one of many, literally hundreds of ACO type programs that are out there. But the Medicare Shared Savings Program saved Medicare $2.4 billion in 2024, which is a pretty significant number. Can you break down what that Medicare Shared Savings Program is and why this matters?
Yeah, so the shared savings program that you're alluding to is an initiative by the federal government that's really focused on delivering better quality of care across the healthcare continuum. So doctors and health systems partnering with the shared savings program to have better care coordination and better outcomes. So it really shifts away from the traditional fee-for-service environment, away from volume-based care, and really focuses on value-based care. And there's just a lot of collaboration that goes into that across the care continuum with the end goal of lowering costs and seeing those shared savings.
Great. So it's not just about every provider across the healthcare continuum doing more, but rather collectively doing better. Does that sound right?
Yeah, that's correct. And so far, the data that you alluded to in 2024 that was published has really illustrated that this model is working. In that headline that you mentioned, CMS actually reported that the gross savings across over 470 plus ACOs reached $6.5 billion. That's just for this past year, which is a number that's up from $5.2 billion the previous year. And since 2012, there's kind of been more increased savings across the board, just illustrating the fact that focusing on care coordination and value-based care is something that's saving the federal government money in terms of this program, and really been a strong driver of seeing more shifts away from those traditional fee-for-service type payments that kind of existed before the shared savings program.
That's great. We've been talking about value-based care and accountable care organizations for a long time, but those numbers that you just threw out there, pretty strong signal. What's driving the success?
Yeah, as I alluded to kind of at the start, care coordination, so hospital discharge planning, doing things more proactively to try to prevent readmissions and all the things that go into care management. I would say another big thing is ACOs that are focused on investing in data and patient engagement and outcomes to really kind of move the needle on what they need to be doing to prevent some of the things that I alluded to, like avoidable hospital readmissions and things of that nature. Focusing on establishing different care plans to manage chronic conditions, but then also more proactively on the front end, doing things like annual wellness visits across a broader population to really just focus on that care coordination, preventative care, catching things on the front end, which then leads to kind of some of the savings that we've alluded to and avoiding the unnecessary cost that comes with some of those healthcare services if they can be caught on the front end.
That's a great high level overview of what makes these value-based initiatives successful, but maybe help me connect the dots back to the DME industry. What does it mean for the DME industry?
Yeah, so I think for the DME industry, it really means that there's going to be more care that's being provided in lower cost settings like the home. And as we all know, DME is really positioned to help become a partner across the care continuum. When care is delivered in the home, that's going to be more utilizers in demand for different types of durable medical equipment. And that's something that the shared savings program and value-based care really focuses on is enabling that independence, long-term recovery in the home. It's cheaper, it leads to cost savings, which then helps the shared savings program success overall.
So that's great. So you see DME as being an integral part of the value-based healthcare ecosystem?
Yeah, definitely. I think accountable care organizations and Medicare Advantage plans are really going to be focused on finding partners that can demonstrate quality outcomes that help them reduce cost. And I think that the DME providers that are in a position to demonstrate quality using data and outcome-based metrics that help show, hospital readmissions and helping avoid those and keeping care in the home. Those two entities, ACOs and Medicare Advantage plans, are really going to be focused on working with those companies and organizations to continue finding savings wherever they can.
Couldn't agree more. So shifting gears a little bit, but within the same realm, let's talk a little bit about the MedPAC report that came out back in July. And I know you've done a lot of reading in that report. What are the key takeaways?
Yeah, so one of the key takeaways right off the top from the latest refresh that we've been diving into of the MedPAC data is really just articulating the aging population increase that we're seeing. A lot of people are thinking of those that are turning Medicare age, which is a noticeable trend and whatnot, but more so seeing even more shifts in the population 85 and older. So the population's getting older, which will increase demand long-term for utilization of durable medical equipment as those patients age and need mobility devices and other DME that can help them do that successfully, hopefully in their home, like we alluded to earlier. And then outside of that, on top of the aging population, just want to keep harping on that shift that we're seeing to Medicare Advantage. It continues to grow really fast. Over 55% of Medicare beneficiaries are now enrolled in a Medicare Advantage plan. So that's not a trend that we see slowing down anytime soon. That equates to over 34 million people. So it's a shift that's really big and really popular and going to continue to be a big part of the healthcare ecosystem. And as we've kind of alluded to already, those plans are really focused on controlling costs, managing the total costs of care, which is going to make for ideal partnership opportunities for DME companies that are set up to demonstrate that they can be partners in achieving those same goals.
Good stuff. Any other trends?
I would say on top of those two things, just continued spend in the home healthcare space related to Medicare and post-acute services as well. These are areas where DME is going to continue supporting patients as they transition out of hospitalization and other areas that provide post-acute services. Really just articulating the value proposition that DME is here to be a solution and help keep costs down for these different types of plans, which then can lead to great opportunities for, increased demand and growth in our industry, which is really exciting to think about.
Sure is exciting. So lots of growth because value-based care, growth because the aging population, not just at 65, but really the 85 plus population growing almost exponentially as we move forward. And then the growing importance of Medicare Advantage. What would you say are the key call to action items for DME providers listening today?
Yeah, I would say a couple different things. We've talked about it a lot already, but making sure to align with value-based care models through ACO partnerships as well as partnerships with health systems. This is something that your referral sources have high on their priority list is this Medicare Shared Savings Program that we kind of alluded to at the top of the episode today. So really making sure to build those partnerships, find new partnerships. I think in the MedPAC data that just came out, there was a pie graph that showed that for Medicare beneficiaries, only 21% of those beneficiaries are still tied to traditional fee-for-service models. So that means upwards of 75+% is tied to some ACO-like model, Medicare managed care in some way, or even the savings plan ACO. So this is something that's going to be really important as the healthcare continuum continues to evolve. And then also the rise of Medicare Advantage. It's here to stay, and projections are showing that it's only going to continue to become more popular. But then really the last thing that comes to mind, and I know this is something that you've went around the industry talking about and we've discussed in great depth, Alan, but making sure your organization invests in the data and analytics to help tell your story. So I know you kind of have some really good insight that I think our listeners could benefit from in terms of how organizations can set themselves up to have the right data, have the right analytics, to be able to showcase that they're partners across care delivery and they can lead to some of the shared savings that contribute to the MSSP plan overall.
Yeah, absolutely. It's something you and I have talked about a bunch. It's something we've discussed in front of many DME providers and certainly will continue to discuss. The industry is growing for many of the reasons that you've mentioned, Tyler, but strategic partnerships are becoming more and more important. Partnering with the right health systems, accountable care organizations, getting partnered with the right Medicare Advantage plans as they continue to grow within our growing segment, and using data to find and ultimately present value to those partners is incredibly important. There's data available through CMS, through the federal government, lots and lots of data sources tied to both the growth in DME, but also providing insights into what strategic partners could be or should be most important to any DME out there, showing lots of insights into hospital performance and where hospitals have areas of opportunity to improve outcomes, and really where DMEs can help support them improving outcomes. So lean on CMS for data. VGM market data is a great, powerful place to go get lots of data around strategic partnerships, both on the payer and provider side, and then state associations, AA home care, lots of different places where you can go get data. And either Tyler, I know you, or myself would be happy to help anybody listening today get guided in the right direction as to where to go get data to find insights into these potential or existing strategic partners. So absolutely use data and get yourself aligned is certainly the message.
I think that's great. And I know we've also kind of alluded to a little bit some of the industry insights portfolio that we have through VGM for members on the member portal under exclusive content. We've really designed that with the intention to gather as much of kind of data and information from a couple of those different sources, and then some other places where we can put that in front of our members and hopefully help with strategic decision making and navigating some of these big changes across the kind of evolving landscape that healthcare always is. So don't be afraid to kind of tap into those resources and ask questions, and we're definitely here to help answer those the best we can.
Yeah, absolutely. For VGM members, VGM vendor partners, other strategic partners listening today, check out the library of content on VGM.com under Industry Insights. Tyler's done an incredible job of building out that library, and we'll continue to add to it over time. So lots of great content there and more to come. Tyler, great insights as always. Thanks, listeners. Stay tuned for more episodes as we continue to explore the evolving healthcare landscape and what it means for our industry. Have a great day, everyone.